All right, here we go with stretches today. We already showed you the door stretch to open up the chest with round shoulder syndrome, forward head, and the chicken or the car seat headrest exercise. I'm just going to show you some real general stretches that you can do anywhere. And if you're like me, you're certainly not doing them enough. I know it's all I can do to get to the gym and do the things I actually want to do. Then it comes down to stretching and you're like, I got to go home. I've got things to do. And it's a huge mistake. Our body is simply a balance of front and back, side to side, top and bottom. And if one thing is dominant or too tight and overcompensating, then oftentimes the opposing muscle groups are overstretched and overtaxed. And whatever the combination is, it can go in many different directions. It creates an imbalance somewhere in your body, and it's a chain reaction because there's not one part of our body that works alone. So when we refer to the kinetic chain, I always like to use the example of the skeleton that we had in our science class, that's hanging on the hook. You don't see the arm dangling by itself and the leg over here free floating. Everything's connected. Well, nothing changes. That's how our body operates. So the things that I'm going to show you today can just very simply be added to your daily routine and help to make a difference. You'll feel better, you'll look better, and it takes the strain off of those joints, which is also a chain reaction. So you may have an issue in your hip that resonates down to the knee, down to the ankle, and so on and so forth. So another chest stretch that you can do just sitting at your desk or wherever you feel like doing it is simply putting your hands behind your head and pushing your elbows back. Now you can't see what's going on in the back, so I want to give you a side view here and make sure that when you do this that you're not arching your back or letting your head go forward. Your hips must stay tucked underneath you or in neutral, belly button towards your spine, and chin is in neutral as well. Then think about squeezing a tennis ball between your shoulder blades. So imagine a ball right between your shoulder blades, and that's what you're holding. Hold it for about 30 to 60 seconds. Optimal. It's probably not going to happen, so let's aim for 15 to 30. Make sure you're breathing, because remember, if you're holding your breath, you're raising your blood pressure, and for those of you who already have high blood pressure, that's certainly not something that I want you to do. All right, so that's our chest stretch. Next, we're going to stretch by reaching behind. This is just another version of it. Also, neutral pelvis, belly button to the spine, head in alignment, and simply pull back and down. Breathe in and out. Now this one you're also going to feel into your arms because obviously you're pulling on them, but those are two real simple ones that you can do. Stretching your back can be a little bit more challenging because oftentimes you have to find something that will hold your weight in order to do the stretch. So in my case, I have my weight rack here, and I can actually hold on to here and just let my body weight fall back. And to give you a side view here, I can also try different angles with that. So to get the sides of my back, or my QL, for those of you who know what it is, and that's where I have the majority of my problem, I can change the direction of my hands. And as I go back, I tilt my body. And then I do the same thing on the other side. And yes, I'm doing this super fast. Those are my favorite stretches, and that gives me so much relief because my back hurts me on a regular basis. And what happens as this muscle tightens up, it actually hikes up my hip. So then it creates that imbalance, and then I start to have issues with my knee. So this is one that I have to put into my daily routine. Another one that you can do, just real simple, stretching the back of your shoulder. Reach your arm across your body like you're going to hold somebody's hands, and then scoop your other arm underneath and gently just pull that arm to your body. Don't let your shoulder hike up. You want to keep it down. And breathe. Now, if you've ever had issues with your shoulder in the posterior part of your rotator cuff, or you've had any surgery I always talk about breast surgery, like breast reconstruction would be one, but obviously if you've had shoulder surgery, this could apply to you also. And you have to stretch through that scar tissue, and sometimes there's adhesions that really limit your range of motion. So not only do these help your posture, but they can also help you to move your arms through the various planes of motion that you have to do on a daily basis. Another one, for those of you who do a lot of typing, I know I tend to get carpal tunnel. Simply pull your fingers down and back, and you will just feel that open up your hand and your forearms. You can also do this by pressing your hand against a wall, but this is the easier version. And of course I'll do that on the other side. And the stretches actually feel so good. Once you're doing them, you're like, oh my God, why haven't I been doing these? Okay, and the next little grouping here are going to be neck stretches. Now I want you guys to be really careful. If any of you have neck issues, you do not want to apply any pressure on your neck. I can't emphasize enough how delicate our necks are, and when I'm doing these, I know what my body's capable of. So as you start to do these, please tread lightly, go slowly, don't just yank your head over to the side. So first off, to create a counter tension, counter strain, I'm going to take my arm behind my body. So this is all I'm doing. But the key here is that I'm going to keep this shoulder down or depressed. Now, I am going to tilt my ear to this shoulder, and that's going to be the start. Then I'm simply going to put the weight of my hand on my head. I am not pulling down. Where I'm pulling is through my shoulder. And I'm also not turning my head up. I'm looking straight ahead. Now you are going to feel this open up through here, and it gives you so much relief. Again, I ask myself, why do I not do this all the time? Now, while you're in this very same position, turn your chin to your armpit. Put your hand on the back of your head, keeping this shoulder down. Just tuck your chin down. I'm not putting any pressure with this hand. It's just resting on my head. You'll feel this stretch move around to the back a little bit. Now, of course, I'm going to do the same thing on the other side, and then turning my chin to my armpit. Okay, next, you're going to tuck your chin to your chest and simply put the weight of your hands on the back of your head. Now, when I say the weight of your hands, I'm not saying push down. Just simply rest your hands on your head. And if you're tight, you're going to feel this stretch move all the way down your spine. And, as you do these, it's going to become easier, and you'll feel the stretch less and less. So then you can start to apply a little pressure as your body or your neck tolerates it. And the last thing I'm going to have you guys do while you're just sitting there at your desk during the day is simply raise your shoulders and lower them down. Now, it's not this. It's a precise elevation and depression. So I am reaching down all the way up and all the way down. I'm breathing in and out. My pelvis is in neutral. My belly button is drawn in. Okay? Now, I'm going to give you a couple quick little stretches. It's a little harder to do the lower body, particularly if you're in a dress, a skirt, or business slacks. But one of the things, and this is going to be a true test to my balance skills doing this on the ball, is to cross your leg. I'm doing all right. Woo! Okay, and I'm going to put my hand underneath this foot. I want to support my ankle as I gently press downward. This is a true challenge. I don't suggest you do it on a ball to start. And then breathe in. Oh, dear God, this opens up my hips, which I am extraordinarily tight. And I'm not going to do this on both sides because, honestly, I'm not sure I'm skilled enough to not fall over a second time. One of the biggest issues that I have is I get really tight in my hip flexors from sitting. And when I'm on a plane, sometimes I just want to crawl out of my skin because they're seizing so much. So this exercise that I'm going to show you will not only stretch your hip flexors, it's going to help counter it by strengthening your glutes, which are the opposing muscle groups. Now, this is very simplified. I'm not saying that this is the only, it's just tight here or weak here. There are many combinations that need to be assessed, but you're not going to do yourself any harm as long as you do these gently by doing these stretches. So you get into a lunge position. Okay, you want to make sure that when you're doing a lunge, your front knee is lined up directly over your ankle. Now, most people, when you do a lunge, you have the back leg stretched all the way back and you're slightly arched. Well, what I want you to do is bring that back foot in and tuck your hip under you. So you're doing a pelvic tilt. Now notice, my hip is lined up directly over my knee's lined up directly over my hip, and I'm going to drop down as low as I can tolerate, while I'm pulling my belly button in, keeping my head in alignment, and I am actively contracting my glute while I'm getting this fabulous stretch here. When you can't stand it anymore, squeeze that butt to come up. Take a break. You can turn around. You can do it on the other side. So again, knee is over the ankle. Hip is lined up over the knee. Get that hip tucked under you. Do whatever you need to for balance. And then only go down as far as you can tolerate. My knee hurts more on this one, so I don't go as low. But activate those gluteal muscles. Pull that belly button in. And I am out of breath doing that. So it's not to say I'm Superwoman or anything, but I do this pretty regularly. It's an exhausting little stretch because you're also contracting the muscles and doing a strengthening exercise. So it serves two purposes. Another one that is often tight on most of us is hamstrings, back of your legs, and calves, and can also contribute to altering your spinal posture and flattening out your back. Just something that's pretty benign and not likely to hurt you if you have a bad lower back is very simply, you're sitting in a chair, reach your leg out in front of you, and let's see if we can get this in the picture here. There we go. Okay, and keep everything in alignment and just reach forward for those toes. Try not to round your back. Just hinge at the waist as you go forward and reach for the toe. And God knows, most of us can't reach our toes. Don't worry about it if you can't. But more importantly, don't slash over. Keep elevated and hinge. Pull those toes towards you. That's going to stretch your calf and your hamstrings. And then, of course, do that on both legs. So that is by all means not exclusive. There are many, many more stretches that can be done. But if you incorporate those few stretches in during the day, guaranteed, you're going to feel so much different in a week or two. And then you can start the rest of your exercise program, which has to incorporate doing some form of weight-bearing exercise. If you're not lifting weights, forget about getting ripped or getting a six-pack or any of that. We are all aging. We are at risk for osteoporosis. God forbid those of you who have undergone hormonal therapy for cancer or chemotherapy or any number of other things that actually make you more prone to osteoporosis, you absolutely have to be lifting weights or doing some form of weight-bearing exercise. That could be bands, that could be lifting weights in the pool. Of course, they're not metal weights. Sometimes it's even yoga and holding a pose for a prolonged period of time, or Pilates and you're using more resistance on the reformer. So I'm not saying you have to lift weights, but you have to do weight-bearing exercise. So stay tuned. I'll continue to give you some really important tidbits that will help to make your life that much better. Have a great day.